Hello everyone, it's another beautiful year to celebrate the nurses all over the world. Shout out to all the nurses, shout out to Health Circumference for organizing this, and a very big shout out to our sponsor, Renewed Fertility Clinic. Before I proceed, I would like to ask a question. Have you ever wondered why there is increased prevalence in the rate of heart attack and sudden death in the society? You're wondering, right? But then why do I ask you this? This is because the objective of this presentation is to help us understand the heart as an organ, how it sustains life, what heart attack is, causes, clinical manifestations, immediate intervention when it happens to self, others, how soon an intervention can save a life, and finally, prevention. My name is Okeke Amanda Ibubichuku, a student cardiothoracic nurse. Now let's proceed. The heart is a hollow muscular organ found in the thorax towards the left and is about the size of the owner's fist. The heart contains muscles that helps it contract to supply oxygen and nutrient-rich blood to all parts of the body through a network of blood vessels. The beautiful thing about the heart is it contracts on its own. It initiates contraction to supply oxygen and nutrient-filled blood to all parts of the body to keep us alive. Therefore, it's advisable to practice prudent heart living so as to have a healthy heart and a healthy life. Now, let's quickly look at what heart attack is, or myocardial infarction. Heart attack occurs when there is interruption of blood supply to the heart. This interruption could be as a result of obstruction by a blood clot, which can occlude partially or completely. Now, there is a major cause of heart attack, which is coronary artery disease. This coronary artery disease narrows the blood vessels that supplies the heart. Inasmuch as the heart sends blood to all parts of the body, it receives blood too to keep it working and active. So once this blood vessel gets narrowed due to buildup of cholesterol, fats, other substances over time, it forms a plaque and then makes the lumen of the blood vessel narrow and then impairs blood supply to the heart. Then there are risk factors also that can actually predispose one to coronary artery disease that include increasing age, hypertension, unhealthy diet, autoimmune diseases, family history, among others. Now, let's talk about clinical manifestations. About 1/4 of heart attack are silent. Then about majority of people that get this come down with chest pain, with a feeling of pressure, heaviness, squeezing, tightening across the chest. It radiates to the neck, to the shoulder blade, to the arm, and all. Then, person comes down with shortness of breath, nausea, vomiting, dizziness, fatigue, sweating, among others. Now, let's quickly look at immediate intervention when one gets an attack. It's very important. When you experience any of the symptoms, please stay as calm as possible and then put a call across to the emergency medical service if you have a functional one. But please, if you do not have a functional one, quickly call the neighbors, your friend, anybody around to quickly take you to the hospital. You don't need to panic, but then you do not need to dispel the symptom and say, okay, it could be stress, it could be a fall I had some months ago. Please do not do that, because if you keep wasting your time, it keeps damaging the heart. A study suggested that one can actually take a tablet of aspirin because it contains antiplatelet properties that can actually dissolve a clot. But if you do not have this, stay calm, call the EMS if you have a functional one. If you do not have, get your neighbor's friend to take you to the hospital as soon as possible. Then if you're not the victim, what do? Please, first of all, keep this patient calm, get the patient seated, using tight clothing. Please do not let the patient deny the symptoms. No, do not allow that. And then quickly call the EMS or take the patient to the hospital. That is the least you can do for this person. You can also give a tablet of aspirin if the person is not allergic to it or if it's available. Then, how soon can an intervention save a life? It is best that someone that had an attack gets treatment within 1 hour of an attack. Studies have it that about half of heart attack occurs, like death with heart attack occurs within 3 to 4 hours of heart attack. Most people dispel the symptoms and say, oh, this could be something else, and then rest and feel, oh, it's stress. But the worrying thing about heart attack is that it occurs in sleep and while at rest too. So it's very important that we get help as soon as we get any of the symptoms. It's better to err on the side of caution than to predispose ourselves to something very bad. Because once you do not get help when you need, it can result to cardiac arrest, and it's very, very bad. Now quickly, let's talk about prevention of heart attack. The beautiful thing is that we can actually help ourselves, right? Now let's talk about prevention. We know the drill already. All these risk factors I mentioned earlier, all you need to do is do them. Do not take illicit drugs, eat healthy diet, exercise regularly, monitor your blood pressure, check cholesterol levels, avoid tobacco use, limit alcohol intake. And that is it. Once you do this, you're practicing prudent heart living, and you're definitely going to have a healthy heart. So once again, shout out to all the nurses all over the world, including myself. Shout out to our sponsor, Renewed Fertility Clinic. Let's all have a blessed and a wonderful Nurses Week.